Right? It's very quick. So I love to talk to, oh, this up and down? Mm-hmm. I would love to talk to Fiona, my friend, after about burns. So see, after. Next slide. Which one? Left or right? Okay.
Please stand.
Okay, so I have this patient. He's a farmer from Jamaica. So Canada actually employ our seasonal worker farmer. He was there in June last year, and in the course of his duty, he got burned. So I must say the Canadian system is really good. Within a week, he got grafted from his thigh to his arms. And I thought, wow, that's good. So 3 months later, he got all this keloid or hypertrophic scar. I don't really differentiate them, forming on his arms. He came to my office, and he also did laser treatment, 3 courses, and was sent home because the contract is up, and he's not ill, just with all these keloids. So he came to me, and I said, well, okay, let me see if I can help you. I'm going to give you some starter cream of mine that I have created. I've been using on my patients since 2002. So this is the before and this is the after. I think I'm missing one slide. Let me see. No. Okay. So this is 8 months after. Just monotherapy, okay? Just the cream alone. So that was easy. It's the donor site. Oh, right. So that's all. You can see this all before and after. And then donor site. How do I get this to run? Where's my? Yeah, but I have to play it. Okay. So that's side by side comparison before and after, okay? All right. All right. So next now, you guys can appreciate the decrease in, yes? You guys can appreciate that? Yep. So the next set, this is, yep. Next. Again, I'm more proud of the thigh because, I mean, to be honest with you, this is the first patient I ever tried after burn. And especially this one, it was so thick when he came. Yeah, I'm going to do that next. So again, so this is like, I show you the 3-dimension and slide by slide how it look with each of them decreases, okay? So these are the patient concerns. Pain, can't sleep, can't work. And it bothers the wife because he can't sleep, she can't sleep. And it's worse than with heat and sweat because now he's back in Jamaica. Whoa, we're like 98 degrees to over 100. Luckily for him, he lives in a mountaintop about 3,000 feet above sea level. But once he gets into town, terrible. And what's so terrible, he can't even sit still in church, which is really our form of entertainment on Sunday, if you're not a soca fan or reggae fan. Limited range of motion, as you can imagine, is across a joint. He's a farmer. He needs to go and work. He can't work because it's too much heat. He can't even do anything. Of course, it's a financial burden because he was the main earner. So I always do this whenever a patient comes to me. I always ask them, I'm Dr. Yap. How can I help you, if I can help you? What are your concerns? Because I have learned being a doctor, a dermatologist, my concern may not be my patient's concern. Be very clear about the end point that you want. Because I was quite upset with him because I wanted a picture. I want to come here like before and after, nothing. Like my previous picture I have presented to you all. He did, when he came, he said, I said, it doesn't look like you've been using the cream. How do we know? We dermatologists know, because when you use the cream, you will see some hypopigmentation. Right, Albert? Yes. So he hasn't used the cream for over a month. And then I'm thinking, why wouldn't you come back and get some more creams? He said, but doc, it not bother me. It's not itching, it's not paying me. It's good, man, it's good. So this is a concern for us as clinicians and investigators, because sometimes we have endpoint that's not achievable. We need to understand that. Their endpoint is no pain, no itch, but our endpoint is not there. That's how great we are. We make it disappear. So I'm just suggesting that topical therapy is an effective component in the management of post-burn keloids, particularly people who live in the mountaintop, maybe not 1,000 kilometers, I don't know the kilometer conversion, but 60 to 100 miles away, they don't have anything. They don't even have access to injection. So Albert is thinking right, because we're dermatologists. So I'm just coming up with another method of treating keloid as an adjunct to all the therapy I've been hearing today. Because whenever a patient comes to me, I would say, this is bigger than me. Let me see. I will call all my colleagues and consult and say, who will take on this case first? And how are we going to make this person better in the circumstances? And that would include distance and bank account. That's all I have to say. See, we now can go to dinner.
Thank you very much. I think we can discuss everything with a very small reception, very short.
Thank you for this beautiful day and a lot of discussions. The discussion.
Reconvene tomorrow at 9 a.m.
Wow. This one is for the morning. This
This one. It uses this one.
I don't know this both, but this one is from the man from Peruvian. You know,
Give it to them.
I will give him, but this one I don't know.
Oh, I'll find out.
Maybe
I'll find out.
come here and they will come.
That's fine. Good idea.
Good. Everything's good.
Okay, excellent. Thank you very much. It was wonderful.
Tomorrow 9 a.m. Okay, I will come half hour early. Is that good?
Yeah. Yeah.